Portland's largest plant-based Asian, Native Hawaiian, and Pacific Islander heritage event is happening this Sunday, June 1st from 5 to 10 p.m. at the Red on Salmon Street. With over 50 vendors, there will be food, drinks, art, home goods, chef demos, lion dancers, and so much more. Plus, a portion of sales will benefit Asian advocacy nonprofit Apano, which is an awesome organization. To learn more, head over to their Instagram at VeganizerPDX. That's at VeganizerPDX. Last week, the U.S. House of Representatives voted to advance President Trump's massive $3 trillion budget bill to the U.S. Senate. One of its most controversial parts is reducing federal spending on Medicaid by nearly $700 billion over a decade. Now, that's a move that would have big consequences for the 1.5 million Oregonians enrolled in the Oregon Health Plan, our state's medical assistance program. So today on CityCast Portland, we're talking with U.S. Representative Maxine Dexter, who represents Oregon's 3rd Congressional District. As a physician and member of the Democratic Doctors Caucus, she voted no on the bill and has been outspoken about the way these Medicaid cuts will affect daily life for hundreds of thousands of Oregonians. And after the interview, Stacey Hoshimiya will be joining us for a conversation sponsored by Portland State University about Invent Oregon's upcoming competition. So stick around to learn more. It's Wednesday, May 28th. I'm Claudia Meza, and this is what Portland's talking about. You know, when I first moved to Oregon from Washington after graduating college, I immediately enrolled in the Oregon Health Plan, or OHP, because I have a chronic condition that needs like daily medication, and I could not afford to be covered. So to someone who's been privileged enough to either always have private insurance or just who is in perfect health, can you explain how Medicaid relates to the Oregon Health Plan? Because I feel like people, it's a lot like Obamacare, like they don't understand words that are connected to the things that they use, you know?
Yeah, so the Oregon Health Plan is Medicaid.
Yeah.
That's just Oregon's title or the name that we have adopted into legislation and whatnot. So Oregon Health Plan covers all people with Medicaid in the state of Oregon.
So what would you say to a Portlander who's never used OHP/Medicaid and doesn't think this affects them?
Yeah, I think, this bill that's cutting hundreds of billions of dollars over 10 years out of Medicaid will impact every person who needs healthcare across this country. What it does currently is keeps many community health centers open, rural hospitals, urban hospitals are increasingly dependent on Medicare and Medicaid. Some of the urban hospitals in Portland get approximately 75% of their insurance payments from Medicare or Medicaid. So it's not the commercial health plans that people get through their employer, it is these government-sponsored health plans. So when we cut Medicaid, even if you've never applied for it, never used it, have no idea who it covers, you will be impacted because there will be fewer providers for healthcare, there will be fewer nursing homes available, there will be fewer hospitals open, and there will be fewer people who can come into your home and give healthcare, whether that's a physical therapist when you're recovering from a surgery or a 24-hour healthcare worker as we age in place. So without question, Medicaid helps everyone. And then on the other side is the economic benefit of Medicaid, that people like you can have a job that doesn't offer benefits and have the security of knowing that they can keep themselves healthy. And when you get pneumonia, you can get treated and get back to work. Whereas somebody who doesn't have access to healthcare will defer or just not get care. And then they end up very sick and in the hospital. And that, in the end, we know costs far more to the community and the system at large because people still need care. Somebody still has to pay for it. And if it's not being reimbursed by Medicaid, it is being reimbursed by taxpayers.
Right. You were discussing how so many hospitals, urban as well, not just rural, are dependent on Medicaid insurance for payment. And I just wanted to talk a bit more about that because a recent report showed that half the hospitals in Oregon are operating in the red. I mean, a regular listener would have remembered that we talk a lot about how OHSU, legacy, everyone's in trouble. So if thousands of people lose coverage, are we at risk of just seeing these hospitals close, or will there be another, like something else that kicks in?
Yeah.
Like we're always just waiting, like, oh, something will work itself out. Like, what's the reality of the situation?
The reality is we know hospitals are going to close. As you said, hospitals are hanging by a thread right now, and that is dependent on the current level of Medicaid coverage, as well as the ACA subsidies that were paid and they expire this year. Those being extended also are really important for hospitals. So without the stability of government-sponsored insurance and the subsidies that keep them open, those hospitals that have been hanging by a thread are going to close. And the Oregon Hospital Association, the American Hospital Association, they've all been very clear about this. And what we know is that when hospitals close in rural America, what it does is it's a funnel effect. There's only so many hospital beds to go around. When somebody's having a stroke or a heart attack or they need cancer treatment, they still need a place to go. And so they'll have to go farther. It'll take longer. And there will then be fewer beds available for people in the community where the hospitals that are still open remain. Mm-hmm. So no matter who you are, if Medicaid cuts lead to rural hospitals closing or urban hospitals closing, there are fewer beds available for the care that everyone needs. And in Oregon, it's a particularly problematic issue because we have very tightly controlled or regulated the number of beds that are available for acute care across the state. And we've done a great job making sure we don't have excess hospital beds. But we felt during COVID the impact of that when all of a sudden there were a lot of people who needed care. We didn't have enough hospital beds. If hospitals are closing, that's going to happen again, even without something like a pandemic putting pressure on the system.
Yeah, I mean, just one bad flu season, right?
Right.
So you're in a unique position because you were a Kaiser Permanente physician, which is, when I think about those boxing movies where someone's just been shadow boxing for half the movie and then they get to the big fight. I feel like this is your big fight because you're like, how the healthcare system works. So many people in Congress, they do not. Yeah. And you do. So I'm sure you still have contact with some of your old patients, I'm assuming. What sort of stories are you hearing from constituents? Like, who will be affected by these changes to Medicaid?
Yeah, the first thing I'm going to say is my experience as a Kaiser Permanente physician has done two things. One, it's taught me the importance of giving providers or clinicians control of care. We don't do prior authorizations. Nobody tells me what I can or can't order for my patients, and my patients don't have to go through prior authorizations. So they get the right care at the right place at the right time. And I know that that is foundational. That is not what the vast majority of Americans experience. And I believe strongly that a patient-centered care system that gives them the right care at the right place is fundamental. So I ran for office because I believe that that kind of care needs to be available for everyone and that we need a reimbursement system that pays for keeping people healthy rather than pays when people get sick, because we need to incentivize the care and the outcomes that we want rather than paying for the expensive stuff, which is what happens right now. And then we get to, times like this, where I also was the chair of the board at Northwest Permanente, which is the physician group, the Kaiser physician company. So I understand the healthcare business as well. So I know that when you limit healthcare insurance payers and you squeeze them and you put them into monopolies, they have disproportionate power. And so we know that the special interests are getting more and more power as they, United Healthcare is enormous. So we've got to shut this down and shift how things are paid for in this country and who gets paid. And we also see as a clinician the importance of taking care of patients. I know when people have to make an impossible decision sitting in my office saying, I can't afford to come back to see you because it costs me $50 for a copay. And if I do that, then I can't buy groceries for my family for that week. Mm-hmm. Those decisions are real. This is not just hyperbole. Like people sitting in my office saying, I can't fill my insulin, even though I'm in the hospital with a ketoacidosis, which is when you don't treat your high blood sugars. I can't afford it. So I'm just going to end up back here again. Like, those are the things that are happening in real time in our communities. And we are going to extraordinarily expand that. If we limit Medicaid, Medicaid is some of the most reliable, comprehensive coverage that we have that gives primary care the incentives. People are incentivized to get care before they get sick. Now we're going to shift all that. And so my patients, I just ran into somebody at a Memorial Day celebration yesterday who I've seen for a lung disease, and she's doing great. She's controlled. She's feeling fine, but she was worried about what's going to happen to the doctor's office, whether or not it was going to stay open because, of all these cuts. So even if you have insurance, people understand that the system's in trouble right now.
Right. All right, well, let's take a quick break here, and when we return, more with Representative Maxine Dexter.
Test, check 1, 2. You know you need unique New York. You know you need unique New York. Does that sound all right? Ah, that's better. You can always tell something's missing when you get isolated results. Like AI that's only right for one of your systems. Get AI that can work across your data and applications. Learn more at IBM.com. The AI built for business. IBM.
Ryan Reynolds here from Mint Mobile with a message for everyone paying big wireless way too much. Please, for the love of everything good in this world, stop. With Mint, you can get premium wireless for just $15 a month. Of course, if you enjoy overpaying, no judgments, but that's weird. Okay, one judgment. Anyway, give it a try at mintmobile.com/switch.
Upfront payment of $45 for 3-month plan, equivalent to $15 per month required. Intro rate first 3 months only. Then full price plan options available. Taxes and fees extra. See full terms at mintmobile.com.
This bill, it passed through the House. It's in the Senate. And the one thing that you keep hearing from some Republicans, including U.S. Representative Cliff Benz from Oregon, is like, look, we're not going to touch Medicaid. We're not touching Medicaid. We're just going to get the lazies off. So I'm laughing because it's so silly. So there's a provision in the bill that would require about 670,000 adult Oregonians to prove they're working or volunteering to keep their benefits. So when I think that, I'm just immediately like, well, how? Like, how is Oregon going to verify that hundreds of thousands of people are hitting these requirements? That seems like a lot of resources. We can't even pay people who have been laid off. Like, we can't even do unemployment benefits right now, like, properly in the state. But somehow we're going to now monitor all of these Medicaid patients. Can you sort that out for us?
Yeah. The first thing I'll say is they're cutting hundreds of billions of dollars over 10 years out of Medicaid. You don't cut hundreds of billions of dollars without limiting resources to people. So that foundationally, like, that is nonsense. There is not fraud, waste, and abuse that people are getting rich out there off of Medicaid. That is just not, that's not how that works. There is absolutely efficiencies and things that we need to do better. And to your point, part of that is the administrative stuff. Like, we don't process claims as well as we should, and we don't get payments out to folks as well quickly. And frankly, a lot of the dual coverage when people are in one state and then they move to another and they're still, the insurance company still getting paid in both states, that's not because the people, they moved. It's up to the system to figure that out. So the system has things we can do better, no question. But there are not working people who have the time to do paperwork. And it's pages. It's not like one form. It is many pages of paperwork every 6 months, which is what they're saying. So every 6 months, you are going to have to go through and fill out tons of paperwork to maintain your coverage and prove that you're working. The vast majority of people on Medicaid are already working. There are exemptions for people who are caring for minors. So if you are a single parent and you've got children, under the Republican bill, there's no work requirements for them. If you're taking care of an older parent, you're not required. So if those people are exempted, the people who are already working are the ones who are really going to have the paperwork. And every 6 months, having to fill out 30 pages of paperwork, and then make sure that the state gets it, and that they checking your email, checking your mail when you move. Like, people on Medicaid, oftentimes, like, their rent changes and they have to move. So making sure the state can keep up, like, it is a paperwork gatekeeping mechanism. It's these people are eligible for coverage, but they're going to fall off of coverage because they're just going to get lost in the system. So that is how this is going to happen. The other thing that I keep hearing from some of my Republican colleagues as well as constituents is that the illegal folks are on Medicaid. That is absolutely not true with federal funds. There are no federal funds that are paying for undocumented people in America to get Medicaid or SNAP benefits. So it's food assistance and Medicaid that I'm really concerned about. And these benefits are being paid for by the state if they're going to undocumented members of our community. They are not on the federal tax dime. So there's nobody to cut there. That's not a thing. The rhetoric that we're hearing, we're going to get the illegals off and we're going to take those lazy folks who don't want to work off. Those folks are already not on the rolls. Almost everyone is working who can work on Medicaid. And there are a lot of people with disabilities who can't work and they shouldn't be. They can't work. So they also get coverage, and that's not at risk with this bill. The other thing that I just want to say is that it is completely disingenuous for Cliff Bentz or any of my Republican colleagues to suggest that you can cut hundreds of billions of dollars from the Medicaid system and not cut people from Medicaid. It is shady at best. It's an outright lie, most likely. And the fact that we aren't being honest about what we're doing is really harming trust in politicians, because how does one person listen to me saying your Medicaid's going to get cut and then listen to Cliff and hear that it's not? Like, who do you believe? It's politics at its worst when we're not being real.
Yeah. I think a lot of your constituents are scared and disappointed. I know you have a community meeting that's open to the public this weekend in Gresham. What are you planning to tell people? Because I feel like the loss of hope or the anxiety is the feeling that you can't do anything about this, that you're just going to sit here and watch everything burn. So what is your speech going to be about?
Yeah, so the first thing that I'm going to say about that, just in general, is this bill's not done yet. It passed out of the House by one vote. 215, not even like a majority of the House of Representatives, 214 against and one abstained. A couple people from the Republican side slept through the vote, apparently, or they just didn't want to show up and vote. So this is not done yet. It was a very close vote. It goes to the Senate next. And people who want to do something, staying loud, making sure that their voices are heard wherever it is. So come to my town hall where we're going to hear people's voices and hear that frustration. And I will tell you that those town halls fuel what I do, because when I hear 1,000 people telling me to do something, to fight back, or, to have their backs, that is absolutely what makes me want to go to DC and fight. It's that clarity of voice that has really been resonating across the country. We're seeing it in all these town halls. And my Republican colleagues aren't having town halls in person. Cliff had a telephone one because he said, people were being, abusive or, disrespectful.
Oh, disrespectful.
I can't remember. It was in the Oregonian this weekend, exactly what his quote was. But
yeah. That's interesting. And those are his constituents.
Yeah. These are people who, he represents. So, but what I'm going to say is, don't give up. They win when we give up. So we've got to, know that your voice matters. It matters to me, and my ability to represent in DC has everything to do with what people are telling me. When I hear that folks are struggling, I was walking in my district and heard from someone who wanted to tell me that things aren't okay, that folks are losing their jobs. That weighs heavily on me. I'm a mom, I'm a doctor, I care for people. That's what I do. And hearing that people are really scared and worried about their children and their futures, I'm there to fight for them, and that's what I'm going to do. So look forward to people showing up in Gresham.
Yeah. I just wanted to confirm what you said about Representative Cliff Bentz. This is from the Oregonian. He chose to meet with constituents virtually so that he could reach more of them at once, was what he said. And because some in the crowd of his in-person town halls earlier in the year were, and this is in quotes, borderline abusive. So yeah, you weren't painting stories there. what's next? I'm curious if there is a plan B happening right now on the state level, because, the state does depend on federal funds for Medicaid. The Oregonian ran an op-ed last week suggesting that the state is going to need to take over the responsibility for some of this healthcare spending and is going to have to make some really hard decisions to do so. Are you already having conversations with our state leaders about this issue? Like, we're already running numbers. Can you just make us feel better right now, please?
I wish I could make you feel better, but what I can say is that we have been communicating. So as soon as that bill came out, and then what's called a manager's amendment, which at the very 11th hour, literally in the dark of night, they changed the bill, that has gone to the governor's team. And so we are hearing from the governor's team, as well as state representatives and my former colleagues. I just was speaking with several of them yesterday, and the treasurer and all that we know that, one, the budget forecast that Oregon just received, I think it's approximately $750 million less than we were expecting. So we're already about $1 billion short. Well, $750 million shorter of what we thought we'd have to spend. And there's 1.4 million Oregonians currently who rely on Medicaid, and we're expecting approximately $1 billion over 2 years. So 2027 to 2029, there will be approximately $1 billion that will not be coming from the federal government that Oregon will either have to fill in, backfill that with state dollars, limit coverage, like change eligibility, so further eliminate, people off of Medicaid, or raise, copays and other things, which, is totally against the system, or cut reimbursements to clinicians and hospitals and all those things. So we know that people are barely keeping the lights on in their clinics and their hospitals with the current Medicaid reimbursement. So if you cut that significantly, like, we know that hospitals are going to close then too. So there's only a few levers you can pull to pay for healthcare. It's either charging the people more for it, paying less for it to the system, or getting more taxpayer dollars to fill in the gaps. Mm-hmm. Yeah. So the state is thinking about it. They know there's hard decisions to make, but we have things like education and bridges and transportation packages and things that are really important to the state too. So impossible decisions will be made.
Yeah. Well, Representative Maxine Dexter, thank you so much for spending some time with us, explaining the fight ahead. I know this feels like an impossible fight. I'm not trying to drain any hope or fight from you. I'm just saying this feels, as someone who is just sitting here, as you can see. I think you're actually standing and I'm literally sitting. It feels overwhelming. So it is helpful to hear it from someone who's working on it, like where we're at. So thank you.
No, Claudia, and thank you. And I just want to say, people don't give up hope. I am not going to give up. I need you to not give up. The right things are going to end up happening. It's just going to be painful in the process. But we are in this together. I'm going to fight like hell. And I hope that everyone will just keep hope, because once we give up, that's really when things get bad. So I'm standing with you. Please, know that it's okay to take a mental health break and then jump back in. And what you're doing right here, elevating these issues and making sure people can hear directly from us, that really matters. So thank you for being a part of it.
All right, don't go anywhere. In just a second, we've got a sponsored segment by Portland State University. We are chatting with Stacey Hoshimiya about Invent Oregon's upcoming student competition. Claudia Meza here with Stacey Hoshimiya, the director of the Center for Entrepreneurship at Portland State University. I've heard a lot about Invent Oregon. I know one of the taglines, Stacey, is helping students across Oregon turn big ideas into real-world solutions. What's the pitch? How would you explain what you do? What is Invent Oregon?
First of all, thanks for having me here today. Big fan of the show, so I'm excited to be here and be able to talk to you about what Invent Oregon is. Basically, Invent Oregon is Oregon's only statewide collegiate invention competition.
Oh, wow.
The CE, or the Center for Entrepreneurship, we've been stewarding it for the last 9 years. So we're 9 years in with this. And basically what we do is we give access to entrepreneurial education because we believe this is transformative for students' lives, because it's more than a competition that we do. It's actually a launchpad for the next generation of entrepreneurs and innovators to turn their ideas into actual impact.
So how long have you been working in Invent Oregon, like that program?
I came to Portland via Morocco, the country,
Wow.
in May 2023, and came on as the assistant director at the Center for Entrepreneurship. And I walked right into boot camp, which is like the 3-day immersive design sprint that we do for the students right at the beginning of the program.
Gotcha.
So that was my entry point.
From the time you've been there, you've seen 2 go through then, I suppose, 2 of these programs. Which was the coolest invention that's come out of your group?
I remember so many, and they're all awesome inventions. Like, it's really impressive what these students are able to come up with. But like from my first year, 2023, what I remember the most is the automatic field tourniquet. And like, this was something that seems like it would be as ubiquitous as like the heart thing on the wall. What do you call it?
The defibrillator?
Yeah, the defibrillators on the wall.
Yeah.
But they envision like putting like AFT right next to it. And this is basically, an automatic tourniquet, because most people like do not know how to apply tourniquets
And they
properly.
bleed out.
And they bleed out in like 5 minutes. And so that's not enough time for an actual, first responders to get there. So this thing was going to like automatically tighten to the right compression, take vitals, and like basically save lives, because it could do it right away, because it would not lose people due to human error with like applying the tourniquet. So I thought that was awesome and
really
had
cool.
crazy application in the world.
Mm-hmm. What kind of support are students getting during the program, like to help these, tourniquet machines come to life?
It starts with boot camp, which is like 3-day design sprint. And we bring in like facilitators and instructors that are like highly renowned in their fields. And they just basically get a chance to workshop their own ideas, right? And it's like 3 days immersive. We bring in alumni. They get to pitch for feedback. We have a big networking event. We kind of do like the speed dating type of thing where we bring in people from our professional network. They get a chance to meet the cohort. The cohort gets a chance to meet them. And then like later on in the program, we match them with a mentor during the process, right? So it's like a way for them to actually like see if they vibe with the person before they're going to work with them. They get one-on-one guidance from someone like me or some of our staff to take them through the program. They all get a $2,000 prototyping grant to bring their idea to life. Yeah. They get access to all our tools and resources, like lots of networking opportunities. We pay for all their accommodations and meals and reimburse for their travel. And at the very end, it all culminates into a pitch competition and a prototype exhibition where they get to compete for $30,000 in cash prizes. So yeah, and those are unrestricted funds, so they can do whatever they want with them.
Wow.
So it's really all about expanding access to underserved communities, like both rural and urban like areas throughout the state. It's about leveling the playing field. So this like opens up opportunity to anyone, no matter what your background or economic status is. And this is all thanks to our funders at Lemelson, Business Oregon, Roundhouse, and Ford Family Foundation. Like they're the ones that are helping us like really create this innovation pipeline and make an entrepreneurial ecosystem throughout the state.
Right. Well, this cohort, their big finals are coming up on June 27th, right? So what can folks expect? Can you give us, are you able to share a little bit like what's coming in? And, and not only, I want to know just like, okay, here are a few highlights of what you might be seeing, but like, how can people get involved as well,
So June 27th at University of Portland, right here local to St. John's, we're going to basically have this innovation showcase. We've got like 21 teams from 18 different schools this year. And they're going to do live pitches. There's going to be a prototype exhibition where you can get up and close with what they're doing and ask them questions. We'll have a keynote from one of our past winners, Jen Zimbarn. She's going to talk about how Invent Oregon and like these kind of competitions have like influenced her own career path and journey. Then we're going to have awards and a reception at Javelina, local mixology bar. We're going to have like tacos from Beto's and also like live music from Hot Love and Jazz Babies. And all of this is free. And so we really want everybody to come out and support this next generation of innovators, lift them up, because like this is all about opening their eyes to all the possibilities of their lives, right?
Well, Stacey, thanks for being here. Again, check out that Eventbrite link in the show notes for free tickets. And to learn more, anyone who is interested in becoming a mentor and supporting the next generation of student innovators, check out the intake form in the show notes as well. Thanks again for listening. And Stacey, thanks for taking the time to break it down to us.
Yeah, thanks so much, Claudia.
Before we head out, I wanted to take a moment to thank all the folks who signed up to become a CityCast Portland neighbor during our spring campaign. We've got a whole bunch of new neighbors who are keeping this thing going, and we are so grateful. We can't wait to see you at our regular member events. And thanks especially to Amy K, Nathan C, Mandy M, Susan Z, Ron E, Sierra H, Hannah W, Chris C, Julia H, Sam P, Melinda F, and George D for joining us over the weekend. For those of you who missed the campaign or didn't get a chance to sign up, it's not too late. You can become a CityCast Portland neighbor at membership.citycast.fm. You can sign up for just $10 a month. That's membership.citycast.fm. Well, that's all for today here on CityCast Portland. Thanks so much for listening. We'll be back tomorrow morning with more from around the city. Until then, see you with Slims.